Good evening, public safety community. Welcome to this week's episode of PSN Now, News of the Week. I am Jason Karp, Esquire. I am here with my good friend and colleague, Thorin Joaquin Kennedy, otherwise known as TJ. What up, TJ?
How are you, Jason?
I'm great.
Good.
Great. Hanging in there, you know, moving, grooving, shaking. Do what we need to do. Getting through COVID. Making things happen. So let's talk about the news. Got a lot going on. So let's start with just a little bit of COVID action, and then we're going to move into, you know, a lot of what's going on in the policing, a lot of the changes going on in policing, police enforcement, a lot of legislation we're seeing. It's coming rapid fire. I can't even keep up with it. It's happening so fast. So let's try to pull this all together for our listening audience a little bit, and we'll highlight what's going on, and we'll go from there. So first and foremost, one of the things I've heard this over and over from public safety, and then here in Loudoun County, they just issued a press release. Folks are not calling 911 because of fears of COVID. And that's a problem, obviously. And so in the press release, they wanted to convey to the community all of the steps they're taking to absolutely ensure that it's perfectly safe. In fact, probably cleaner and safer than it's been previously because of all the steps they're taking. So first and foremost, if there are symptoms, conditions, injuries, chest pain, anything along those lines, you've got to call 911, period. You know, you can't wait. It's not worth it. So you just got to go. Number two, the hospitals, EMS, they are doing extraordinary things to keep you safe. So screening procedures for everybody coming in, temperature, masks for everybody. In Loudoun here, they're actually have the COVID patients in a separate area of the hospital. They're doing extreme sanitization and sanitary measures, those kinds of things. So long and short, if you have an emergency, you got to call 911. You got to go to the hospital, plain and simple, period. TJ, anything to add to that?
This is horrible what's happening right now. We literally have people that are having heart attacks, not calling 911 immediately. We've known for many, many years that the survivability of a heart attack, a stroke, other events, trauma when it comes to bleeding out, all these kinds of things are greatly improved when you call 911 quickly. And that should not be any different during coronavirus. We've seen amazing disinfection being done by EMS and fire departments across the country. You absolutely have to call 911 when you're having any of these typical major medical problems where you would have called 911 before. And there's already an underutilization of 911 for real, no kidding emergencies because people, for some reason, think it's not a smart idea to call. Please call. The survival rate for strokes, for heart attacks, for major events is drastically higher. And right now, some of the early studies we're seeing over the past 2-3 months is cardiac arrest survival rates are down because of people not calling 911 and not going quickly to the hospital with an advanced life support ambulance system. And so you have got to call 911. This is not anything to joke about. It's critical.
Yeah, and my suggestion is, you know, to those public safety agencies, public safety folks who are watching, I really like what Loudoun did. They issued a press release to the community laying all of this out and encouraging people that, you know, for anything, that's what 911 is here for. That's what their emergency response is here to handle. But, you know, it was good to see, and I think it gives the community comfort to know that the healthcare professionals are taking these steps to keep them safe. So I really like that. So if other agencies or jurisdictions haven't done that, I suggest reaching out to your communities, letting them know what you're doing to protect them. Moving on to kind of a hybrid of things that are going on with COVID and policing is in Alameda County, a new program called, I think it's CAT, Community Assessment Treatment and Transport Team. So this is effectively almost like a community paramedicine situation, but also emergency response. So where now a social worker, healthcare professional, psychology professional is being paired with an EMT for certain calls to deal with drunkenness, drug abuse, certain types of things that police have ordinarily been called upon to deal with. But now this kind of CAT team, this CAT SWAT team, so to speak, is now being put together and is soon going to be launched in a pilot program in several areas around Alameda to kind of deal with these solutions in a more effective and efficient way with this kind of pairing of professionals. TJ, thoughts? I mean, is this, where we're headed? I mean, I think we're going to talk a little bit more about this with some of the policing and defunding things we talked about last week. This was an independent effort, but kind of dovetails with what's going on in the communities right now.
No, I think it's another example of a county trying to look at ways to change the way they operate day in and day out to provide better service to their citizens. And I think that when we look at mental health crises, if we look at those that are dealing with addiction and other issues, there are talented, trained personnel that can be responding to those. And I think investing in that response, as well as the personnel and the appropriate training for both the emergency medical services personnel and the social workers and others that are part of that, I think are critical. I think they need to have the right communication tools, the right technology, the right training. And if we're doing that across the country, I think it's going to reduce the amount of bad interactions that occur because you have the right people with the right training and the right technology to respond to that call.
Yeah, no, absolutely. They dub it a licensed behavioral health clinician will be in the ride-alongs. It won't be a traditional ambulance. There'll be kind of a souped up Chevy Tahoe. They said that they'll be using in the county the areas are going to be Oakland, San Leandro, Hayward, and Alameda sometime this summer. And they will be dispatched through 911, which is interesting. So that'll be a little bit different as well as to, what the guidelines are for dispatching this type of response versus a traditional police response. So you also get into standard operating procedures and having to change some of those criteria and the policies that go in place in order to know who and when to dispatch, appropriately given the call. With that said, let's do a little rundown of what's going on across the country. So a lot of changes, even since last week when we talked regarding policing and this concept of defunding or reallocating funds that have traditionally gone to police and are now potentially going to other social type of services. In some cases, they're augmenting the police budgets. In other cases, maybe that they are diverting some of those funds. But what we do know is that cities, counties are looking at how they deal with public health and public safety very differently now and are moving very quickly. So at the federal level, we know Trump signed the executive order yesterday regarding changes to policing. It is very similar to a proposed Senate bill that is currently pending. And so some of the things it addresses are new policies and use of force. It doesn't fully ban chokeholds, but it pretty much limits them except in the case where lethal force would otherwise be authorized. So if you can use lethal force, you could still use a choke type of activity if the officer felt that was necessary to apply lethal force. And the feds are kind of using an incentive model. They're basically, although they don't have jurisdiction, at the state level, in order to receive federal funding, and federal grant monies, they're requiring that these guidelines be adhered to. And I know that the Senate bill is very similar. I think it basically mirrors the executive order. We talked last week that there's a House bill pending that I think goes a little bit further in terms of the kinds of things that it requires and bans. But big first step on the federal level.
Yeah, I mean, it's an executive order. I think that's step one. I think there's both House and Senate bills that cover this with a wide range of changes that are going to happen at the federal level. I think that's important, and I think that's smart, and I really hope there's a good conference committee to get those two bills together with a good outcome for everyone across the federal government and how that affects folks at the city, county, state, local level. I do think a lot of this is going to happen at the local level. We have more than 3,000 counties in America. We have, numerous jurisdictions from the city, county, other perspective that are out there in each of the states, obviously. And I think a lot of this will be done at the local level. I read this morning the update out of the Salt Lake City Council meeting as just an example. We saw a lot of the discussions that I think are happening across the country, but I read a very detailed article about that. And I think it's a good bellwether of just an example of a decent sized city, one of the top 50 to 75 in the country, let's say. And what they did was, took a lot of public input, a lot of public discussion and discourse, and even protesters, all of those kinds of things as a part of that city council discussion. At the end of the day, they moved some budget items around. A good example, they took some of the social work, behavioral health dollars, moved it into a separate budget to still respond with public safety, but gave them a little more control over that budget. I think you're going to see some of that going on. They added some money in a number of cases. They added money for de-escalation training for law enforcement. I think that's it's money well spent, and I think that having more and more public safety training and how to de-escalate incidents is strong. I think they added money for less than lethal tools to be given to all officers. In some cases, it was only certain officers that had them before, so additional budget. I think they had $687,000 for body-worn cameras and less than lethal tools for their officers. So all sworn officers will now have body-worn cameras as well as those less than lethal tools. And I think that's important. We've gone from where some of these things might have been optional in the past, and now it's going to be, across the board, all sworn officers will have access and will use these every day. And I think that, the more that we can train and the more that we can equip folks with the right technology. They also made sure that they have cloud storage for all that video and the costs included for that. These are very important steps, and I think we're going to see, that paradigm shift to more and more of that going forward, and this will become the de facto standard in a lot of cities and counties around the country.
Absolutely. I mean, you're hitting it on the head. You're a great straight man, because I'm going to take you through at least some of the things so everyone kind of hears what's going on. At the federal level, we talked about that, and that's exactly some of the things they talked about. Better training, de-escalation, increased role for social workers. So that's at the federal level. We're also seeing that at the state level. And of course, states can always go further than what the Fed puts out, on this kind of stuff. And so and we're already seeing that. So for example, you mentioned, of course, Salt Lake City, great example of proactive steps they're taking. And not necessarily, as you said, any kind of reduction in budget or defunding in the natural use of that word, but rather a true reallocation of funding and resources to meet the appropriate need. So for example, we've got Albuquerque, New Mexico. They've recently created an alternative to their police department, for a new public safety department designed to relieve some of that stress on the police by dealing with professionals who are going to deal with drunkenness and inebriation, homelessness, addiction, mental health services, where they'll be the first response. So very similar to what you're talking about here, but in Albuquerque, they've actually created a new department. I know that in LA City, although they haven't created that yet, I just read this morning that they also are supportive of something very similar in terms of reform and creating a separate department to deal with things like drunkenness and homelessness and mental health issues that would be separate and apart from the police department. So that's going on there. Of course, NYPD, New York, a lot going on. We talked about the law that now requires disclosure of personnel records last week. Now it's gone even further. So New York has defunded some of their anti-crime units where they've had extreme amounts of violence and plainclothes policing. They completely defunded it and removed that program from their budget. And the other thing that they're now requiring, or at least Blasio is recommending, is mandatory release of body-worn camera video. So to date, when I say voluntary, it's been voluntary, based on if there's a need to quell certain citizen concerns or other things. Now they're talking about making it just completely voluntary in any case of use of force or where someone's been harmed, any kind of shooting. So that's an interesting take. New Jersey, they're talking about requiring disclosure of names of disciplined officers and anybody who's engaged in misconduct, having that transparency. Connecticut, they've gone pretty far. So they're going with a ban on chokeholds. They're mandating use of cameras, as well as dashboard cams and body cams, as well as kind of this concept of demilitarization, which we've heard a little bit about, but we haven't talked about, where they're looking at restricting the types of military style tools and weaponry that now can be used by the police department locally. That's the first I've actually heard of any state taking action, on that piece of it, and I expect we'll hear more. And they're looking at changes to their use of force policy, training, bias training, and requiring that all steps be taken before force is actually imposed. So it's kind of a requirement of, exhaust all avenues, as well as a requirement for state troopers to intervene. So a lot going on in Connecticut. They're addressing a lot of these different issues. So, a lot going on. Pennsylvania, same kind of thing. California AG has just made a recommendation about banning chokeholds and other police reforms, decertifying and firing police for misconduct. And this is just scratching the tip of the iceberg. So a lot going on in these states. Pay attention. I would say all of these agencies to what your sister and brother agencies are doing, and really look at what makes sense for your jurisdiction. We talked about this last week. Everyone's going to be a little bit different, but a lot going on.
I think the key is to be proactive, and I think be very proactive with solutions. There's a lot of things that have not been appropriately funded over the years, whether it comes to training or comes to technology or comes to equipment. And I think it's really important that folks, put together solutions on the table that can be funded, that will make a difference with all the issues currently at hand, and doing the right thing. And I think that, speak up, make your voice heard, whether you're a police officer, a firefighter, a paramedic, you're in administration, you're on the front line. I think it's really important to suggest good solutions of things that probably, some may have thought in the past but didn't speak up about. Now's the time, and put them forward and make it the best solution going forward. I mean, everybody around the world, not just in the U.S., needs good public safety and needs to have good first responders that are responding to their everyday needs. The majority of everyone in the world does that today, and we need to make sure that they're helping be a part of the future solutions as they modify and as change comes to them. And I think we're seeing some of these already start to happen. I think we'll see more, but I also think it's really important to be involved and be a part of that discussion and bring solutions forward.
Yeah, and the only thing I would add is, just like what happened in Utah, engage your communities. I think this is really important, especially to kind of de-escalate some of these tensions, right, that we're feeling. And when folks say defund the police, I get the knee-jerk response, which is you can't defund the police. It's a matter of how do you engage in that conversation and making it constructive. Let's take that term off the table completely. I hate that term personally. It doesn't really describe what's going on here. But engaging with the community to identify those right solutions, as you just talked about, TJ, I think really, really critical. And the more you can engage in that, community policing and transparency, the better outcomes, we're going to see in kind of de-escalating a lot of the tensions that recent situations have caused. So I think spot on. Last thing I wanted to just touch on was, there's so many different constituencies in public safety, and oftentimes dispatchers get overlooked. I know we've talked a lot about how dispatchers are being made formal members of public safety in the various states. There's been a recent study. So it was the Daily Beast actually did a recent, I won't even call it a study, but they interviewed a half a dozen of dispatchers around the country, both existing and retired, about the current situation with policing. And just some really interesting, I guess, context and feedback and perspective from them. And I think it's important to, identify that and make sure that as all of these agencies are communicating, it's important to communicate and interact with the dispatchers as well, because they see it from a completely different set of eyes, right? Oftentimes they can see these events not only in who they're dispatching and getting the initial calls, they oftentimes have access to local video cameras and other things that are going on where they can view the scene from different perspectives. So I think really important, but I just wanted to, identify a couple of things that at least pretty uniquely throughout all of the folks interviewed, this concept, and again, I'll use the term defunding the police, but reallocating dollars and approaches so that policing is less violent for the 95% of cases that don't require violence, which are the drunkenness and the mental health issues and and the other nonviolent offenses going on. It was pretty ubiquitous, response from that perspective across the board. And I just thought that was very interesting. But I know, given your background in particular, as well, TJ, I wanted to get your insights on that, and how do dispatchers play in this conversation?
Well, I think it's a unique time in the public safety communicator side of the house for our dispatch centers that these public safety answering points around the world are changing with what's known as next gen 911, which means they're going to be going from the traditional landline phone calls and radio LMR dispatching over a console to much more of, 70, 80, 90% of calls come in over wireless today. There's the ability to send voice, video, and data to have different interactions at different scenes or incidents. Next gen is going to be the baseline going forward for many communities. And this means we probably have a lot better data. You could be getting data from somebody's wearable. You could be getting data from their smartphone. You could be getting video of what's happening in the field to send a more focused set of resources to that call, whether that involves behavioral health specialists, it involves EMS, in some cases that are very focused and trained on those particular kinds of issues. I think also there's a lot of calls to 911 that don't elevate to police or fire response that could be dealt with if they're appropriately staffed by that community to respond to it with trained personnel. And you mentioned one, homelessness is a good example where, typically that's not a law enforcement event. It's an event where there are social services needed. It might involve mental health. It might involve housing, different ways to look at that. And I think we need to address these real problems and issues that need to be responded to. I don't think it's going to decrease budgets, quite frankly. I think overall it may increase a lot of budgets because, part of the reason I think we have some of these issues the way we do today is we have defunded a lot of the mental health services, behavioral health services, and other things for years and years, and it is showing. And so I think it's important for all communities to make sure we lay out the appropriate resources, both for human resources, for technology, for staffing, for communications. And I think in the modern dispatch center of the future, many of these things are going to route through there in different ways. And I think we're going to be much more into right resources, right call, right technology, right time to be able to intervene for these kinds of things. And we're going to deal with this in a more global situational awareness around a community to make sure the right resources are available to the people who need them.
Yeah, spot on. I mean, having that interaction and coordination, I think it's really important more than ever that agencies are no longer siloed, and they can't be siloed in this conversation. And I think 911 communicators and dispatchers are going to play a critical role in how, not just policing, but overall public safety. And I think it's going to change. And as we've talked about on some of our PSN Home, episodes, the integration of the different agencies and disciplines, it's not just a single discipline anymore. And I think we're going to see more and more of that going forward. So I think that's spot on.
And I think we can't ignore the fact there's still a critical need for law enforcement, and law enforcement is going to play a critical role in these responses and others. It's just more a matter of, I think, beefing up a number of the sources that have been underfunded and understaffed and don't necessarily all haven't been given the right technology and the right tools to do those roles. And I think, we're going to see those kinds of changes being addressed and a focus on those budgets that need to happen. But it doesn't mean that our traditional law enforcement, fire, emergency medical services, and dispatch centers aren't going to be involved. But in many cases, there might be additional training, additional resources, additional technology.
Yep, spot on. Great way to end. A lot to think about. This issue is not going away. We're going to talk a lot, more about it in upcoming weeks, I'm sure, with a lot of different issues as they come up. So we wish everybody well. Keep strong. Keep on keeping on, and pushing these issues forward. It's critically important for our communities right now. I'm Jason Karp Esquire, TJ Kennedy, PSN News of the Week. We'll see you next